Assalamu alaikum warahmatullahi wabarakatuh. The article for this week titled Comparison of the Outcome of Intentional Replantation in Teeth with or Without Periodontal Involvement, a retrospective study done by Liu et al. In 2024 and published in the JOE. This study was conducted by a group from China, and the aim of this study was to compare the treatment outcomes of intentional replantation in teeth with or without periodontal involvement, and to investigate the influence of related factors. Moving to materials and methods, a total of 157 teeth with a history of intentional replantation between 2012 and 2022 and a follow-up duration more than 1 year were included in this study. Vertical root fractures as well as the cases with less than 1 year follow-up were excluded. The samples included 100 teeth with simple apical periodontitis and 57 teeth with combined mild to moderate periodontal defects according to the following criteria: communication of endodontic periodontal lesion, root bifurcation lesion of grade 3 or less, grade 2 or less mobility, 50% or less radiographic bone loss, 6 mm periodontal pocket, and 4 mm or less attachment loss. The preoperative demographic characteristics, including patient gender and age, thought position, clinical and radiographic evaluation, quality of non-surgical root canal treatment, presence or absence of sinus tract and crown restoration, and intraoperative retrograde filling materials were recorded. Patients were scheduled for follow-up examination at 1 week, 1, 3, 6, and 12 months, and annually thereafter. Clinical examinations including assessment of subject discomfort, sign and symptoms, percussion palpation, mobility, probing depth. Also, radiographic examinations were usually performed using pre-apical radiographs with CBCT used in case suspected of post-operative complications. Moving to the results, the overall survival rates were 93% at 1 year, 76% at 5 years, and 56% at 10 years. Among the 100 teeth with simple apical periodontitis, the survival rate were 93%, 86%, and 79% at the same time points. In contrast, 57 teeth with combined periodontal endodontic lesion, the survival rate were 93, 65%, 36% respectively. The primary post-operative complications that lead to extraction were periodontal involvement, followed by tooth fracture, external root resorption, and persistent apical periodontitis. The outcome of teeth with combined periodontal endodontic lesion were significantly affected by presence of sinus tract and crown restoration. In contrast, no significant prognostic factors were identified for teeth without periodontal involvement. For the conclusion, the long-term prognosis of the teeth with combined periodontal endodontic lesion is significantly worse than those with simple apical periodontitis. The main reason of extraction was periodontal involvement. And thank you.